Cat arthritis, a joint condition that often goes unnoticed, but can significantly compromise a feline's quality of life. Unlike what many imagine, these animals don't usually show pain clearly, which means a cat with arthritis faces silent daily limitations, from difficulty jumping to subtle behavioral changes. Just like in humans, feline arthritis is caused by various factors, from natural aging to genetic predisposition. Thus, this disease can appear at any stage of a cat's life cycle, although it is much more common in elderly cats. Therefore, to ensure early diagnosis and appropriate treatment, it's crucial to recognize the symptoms of arthritis in cats. Paws Paradise will clarify everything you need to know about the subject. Feline arthritis is an inflammation in the cat's joints, leading to pain, stiffness, and decreased mobility. This process can affect one or several joints, directly interfering with the animal's routine. In practice, arthritis can be triggered by different factors, with aging being the most common, as joint wear occurs over time. Old traumas, such as fractures, falls, or accidents, can also leave sequelae that favor the onset of the disease. But it doesn't stop there. Genetic predisposition also plays a role in some cases, making certain felines more susceptible to the problem. In general, Maine Coon, Scottish Fold, and Burman are the cat breeds most prone to joint problems. Additionally, feline obesity is an important risk factor for this condition, as excess weight increases the load on the joints and accelerates wear. In less frequent situations, infections and autoimmune diseases can also be behind arthritis in cats. Each case must be well evaluated to determine the cause of the disease. Despite often being confused, arthritis and osteoarthritis in cats represent distinct conditions. Arthritis in cats is an active inflammatory process in the joints, characterized by pain, localized heat, swelling, and difficulty in movement. It is a disease that can appear suddenly or progressively and, in many cases, evolves in crises that vary in intensity. Arthritis in cats causes pain, stiffness, and decreased mobility, directly interfering with the animal's routine. Osteoarthritis in cats, also known as degenerative joint disease, is not an inflammatory process, but rather degenerative. In this condition, there is a slow and continuous wear of the cartilage, resulting in stiffness, loss of flexibility, and permanent limitations of the joint. In other words, while arthritis in cats is linked to inflammation and can present more acute phases of pain, osteoarthritis in cats is a consequence of chronic wear, usually associated with aging or repetitive use of the joints. It is common for the two conditions to be related, as the inflammation caused by arthritis can accelerate joint degeneration and lead to the development of osteoarthritis. Identifying a cat with arthritis requires attention, as felines do not manifest obvious signs of pain. In general, symptoms of arthritis in cats include decreased willingness to jump on furniture or high places, stiffness in movements, especially when waking up, difficulty climbing or descending stairs, less disposition to play, behavioral changes such as irritability or isolation, lack of interest in self-grooming and cleaning, resulting in dull or matted fur, eventual limping or reluctance to support one of the paws. Cat with pain in the hindquarters may be a sign of arthritis. Upon noticing any of these changes, it is essential to consult a veterinarian as soon as possible. Only a professional can evaluate the animal and establish an adequate diagnosis. This is the first and most important step for the kitten to receive the ideal treatment and achieve a better quality of life. Arthritis treatment in cats must always be defined and monitored by a veterinary doctor, as each case requires a personalized approach. Normally, it involves the use of medication, which helps to relieve pain and reduce inflammation in the joints. In parallel, joint supplements, known as chondroprotectors, may be indicated to protect cartilage and slow the disease's progression. Weight control is another essential factor, as obese cats suffer greater overload on the joints, which worsens the problem. There is also the possibility of applying complementary therapies, such as animal physiotherapy and veterinary acupuncture, which can improve mobility, increase comfort, and reduce the continuous use of medication. And we cannot forget that it is also important to adapt the environment. offering softer beds, facilitated access with ramps, and resting places within the animal's reach, without requiring large jumps. With this set of care, a cat with arthritis can have well-being, living actively and comfortably, even after diagnosis. Understanding cat arthritis is key to ensuring your feline friend lives a comfortable and happy life, especially as they age. Early detection and a personalized care plan can make all the difference. Your cat deserves a life free from silent pain. If this guide was helpful, please give it a like. For more vital cat health tips, expert veterinary advice, and heartwarming content for your beloved pets, subscribe to Paws Paradise and hit that notification bell so you don't miss our next video. Thank you for watching, or